Hi, I'm Loretta Bush, President and CEO for Authority Health. And today we're going to be joining our Community Health Center partners in celebrating National Community Health Center Week. You may not know, more than 30 million people in the United States use community health centers as their primary care medical home. I'm very excited that today I have a very special guest. That's Joslyn Pettway, and she is the Chief Executive Officer of Covenant Community Care. Welcome, Joslyn.
Thank you for having me.
You're welcome. So Joslyn, why don't we start off by telling our listeners what is a community health center and how does that differ from a doctor's office or a hospital setting?
Well, the technical answer would be a community health center is federally funded to care for those who can't afford their care themselves. But what I like to say is a community health center is a health center run by the community, because literally for any community health center, 51% of our board members are patients of the health centers. And our health centers patients are community members that, they live near the clinics that are placed with them. So we're literally, my boss are my patients. And I think that really, filters down into everything we do, both from the services that we provide, the way in which we provide them, the wraparound services that we provide. So I would say that's the key difference, is that any community health center is literally run by the patients that they serve.
Oh, I love that. Because then they have skin in the game.
Absolutely, and then we have to listen to them.
Yeah.
We don't just get to say, well, we want to do this, or we need, I have to run those decisions by a board of directors that has to be 51% at a minimum.
So they
consumers.
are actually able then to guide and tell you what services are needed in that community.
Yes, all of our services are based on our needs assessment, which they help provide as well. Like, they are part of that process, the strategic planning process. So I think that's really the key difference between community health centers and other healthcare providers.
Isn't that amazing to think that you can actually guide the type of services that are going to be provided in your own community as it relates to your care?
That's critical.
Yeah.
So often when you have under-resourced communities,
Yes.
a lot of external organizations can come in and do things, and the people that they're serving don't have a voice.
Right.
They're supposed to just accept whatever is provided. But in our industry, that's not the case. They not only have a voice, they're at the top of the organization.
I love it. So what is the mission of Covenant Care?
The mission of Covenant Community Care, it's my favorite part of Covenant Community Care, is to show and share the love of God as seen in the good news of Jesus Christ by providing integrated, affordable, quality health care to those who need it most.
Okay. I think you've said that mission a time or two.
Oh, yeah, I love that mission. It's what I love the most about it is that mission says, I always say the back half, providing integrated, affordable, quality care, that's what we do, and the front half is why we do it, to show and share the love of God.
Yes. So you've managed to combine the spiritual component along with the science and the medical and all of that. Now, I have to tell you, the thing that I love so much about that and find amazing, and hopefully that's really been helpful in times like these, where sometimes people think that the science and the spiritual have to compete with each other. And Covenant Community Care is showing every day that the science and the spiritual can walk hand in hand.
Absolutely, and sometimes that's gotten really practical. Like, I can think back to when the Affordable Care Act was passed. I remember there was all that controversy about Medicaid expansion.
Yes.
We talked to churches and said, listen, politics aside, this is how this helps you. This is how this helps your health outcomes. This is how this helps people that come to your church and worship. So I do think we've been able to thread that needle from time to time and cut through the controversy so that people can see how different policies actually benefit them, and you kind of get through the noise.
That's awesome. Is it just churches or is it across the spiritual?
One thing I always tell people, you do not have to be Christian to work at Covenant. You don't have to be Christian to get care at Covenant. So it's across the continuum. But yeah, definitely not just churches.
Yeah. Awesome. So now the other thing is that Covenant Community Care recently opened a location outside of the city of Detroit in the suburb. Now, talk some more about that, because I know community health centers have a real focus on the medically underserved, physician shortage area, all of the, the key words and everything. And, many times when we hear those words, we really think about Detroit, Flint, well, urban areas and everything.
Well, first, shout out to Flint, because that's my hometown.
All right, shout out to Flint then. All right.
But definitely, there's a traditional understanding of where the need is. But I think you've seen shifts over the last 10 to 15 years from a few ways, and I guess I'll get into my sociology bag a bit here. But
shout out to sociology.
There we go.
That's where I started.
Oh,
okay.
Really?
Yes.
Bachelor's in sociology. So
mine too.
the need has migrated, right? So as you've seen, we'll get into gentrification, but as you've seen things come in the city, people have been pushed out. And so they've pushed into the suburbs. So you've had a migration of folks from the city to the suburbs. Yes. But you've also had the suburbs endure different economic challenges, like with the economic housing crash in 2008, the bubble, all of that hit the suburbs hard. And so you've seen this, if you go and look really at the statistics, which for any health center, when they open, we have to make a need statement to HRSA. HRSA evaluates how much need is present in that community before they'll award something. And yeah, the need has really grown in the suburbs. And I'll tell a story. We're a healthcare for the homeless provider. Okay. And so we do a lot with the shelters in the city. But I said, well, we were trying to find a way to get some dental into homeless shelters. And so there was a shelter in Oakland County, and it's called SOS. And it was right by my house. I had driven by this building the whole time, never knew it was a shelter. Okay. So I meet up with our dental coordinator, and we go there and tour. And when I walked in, nobody was there. And just the shelter staff. And I said, well, where are all the people? Usually when you go to a shelter, the people that are being served are there. They said they're at work. And I said, wait a minute. You never think, somebody would be homeless, go to work every day and come back in a shelter. That's what a shelter looked like in Oakland County. Yeah. And that was one of the most profound things I've experienced in my career, was to understand the need does not always look like what we think it looks like. And I think you're starting to see that with different health centers being in the suburbs.
Right. I mean, you have really shared some wisdom there, and broken down some myths that I think it's very important, that homeless people don't go to work, and that there's not the working poor.
Right.
All of those things, those messages that we keep trying to get out, but we also have to reframe our own stereotypes as well.
Definitely.
And everything. And what a very powerful message to get out. So your suburban site is in Royal Oak?
We have two actually now. We have one in Royal Oak and then one in Westland, Michigan.
Okay, one in Westland as well. Yeah. Okay, and both of those are thriving and doing very well?
Yeah, both are doing well.
Okay.
Both are doing well.
All right. And and I think the other myth that breaks down about community health centers is that this is poor care. So I want you to talk a little bit about that, because sometimes in the past, if I've, tried to send friends or colleagues, oh, that's for poor people. Do they have real doctors there? I'm sure you've heard those questions before. Are those going to be real doctors? Are they going to give you real medicine? Is it different? Am I going to have to wait for, 6 hours to be seen? So talk about, let's dispel some of those myths about community health centers.
Well, one of the best ways I could dispel that myth is, I mentioned I'm from Flint. My whole family's from Flint. My parents relocated down here to Southfield in 2014. My mother's a Covenant patient.
Okay.
My mother goes to one of our clinics.
Yes.
She has a Covenant doctor. I would not have recommended Covenant to my mom, for anything if I thought it was subpar in any way. She's a retired teacher, has been insured her whole life.
Yes.
Still is insured, but when I wanted her to have a good doctor, I recommended Covenant. Why would I recommend that? I knew the experience would be no different than what she received back home. The facilities are wonderful. Yeah. The providers are dedicated. Most of folks who are working in federal community health centers are mission driven. They really care about treating the whole person. And so, there's, I guess, technical reasons, but the one that probably means the most to me is I told my mom to come to a community health center because I knew there was no fall off in quality.
There's no better recommendation than that.
Absolutely.
I'm telling you, that's a great story. I mean, what can I even say after that?
She lets me tell that story too. I have to get permission.
All right.
Make sure, but she does. She
that's
lets me
a
tell
great
that story.
story. Yeah, absolutely. It's a place for you and I. It's a place where we recommend our mom.
Absolutely.
My sister allows me to say that I've recommended her for our East Side clinic. She's a patient there. So why would we want to be leaders over patient care and over clinics that we would not ourselves go or have our relatives go to?
I think dignity is huge.
Absolutely.
When it comes to treating people, you want them to feel respected and honored and welcomed. And so that comes across in a lot of ways. It does come across in the cleanliness of your facility, the design of your facility. What is the patient care experience about? And that's why community health centers really focus on all of those as well as your health outcomes.
Absolutely. And because of the level of scrutiny that community health centers and teaching health centers get, our physicians are always cutting edge and always learning the newest techniques. And
that's a great point. We have reporting requirements that are high and far above what most have. So we can't fall off.
That's right. We don't get to just go in there and do what we want to do. That's right.
Exactly.
Well, that's great. Well, National Health Center Week is August 8th through the 14th. And this year, the week is going to be honoring all of those frontline workers, the staff, all of our beloved patients that lost their lives due to COVID, those who are still struggling with the after effects of COVID, either psychologically or those who are long haulers who recovered but certainly are feeling some of the effects. Joslyn, talk about Covenant Care's role during the height of the pandemic and then ongoing.
It was unlike anything we'd ever seen. I'd never seen a situation change so drastically, so quickly. You could literally make a plan and that plan would be obsolete in 60 minutes, you know, and that happened a couple times. One thing we did, we pivoted to telehealth very early. We're a multi-site health center, so we consolidated our in-person visits to one clinic, and we really figured out how to do in-person care at that clinic. You know, figured out our screening methods, all of that, and then our other sites we're doing virtual care, which, you know, as an aside, but an important aside, I think that we shouldn't let the lessons that we learned in the pandemic go away with the pandemic.
Absolutely.
And what I mean by that is, we learn different ways to treat people. We learn different ways for access for our patients. And one thing we're really looking at right now is how do we take some of those ways we pivoted in the early days and keep them going to increase access to care for our patients. So it's a little bit of an aside, but
no, that's an important
it's an important part. And I think that it was just drastic. And one thing about frontliners, they were in the pandemic too.
Right.
You know, so while our staff were caring for our patients, we had staff members with COVID.
Sure.
We had, you know, so we had staff members who lost family members to COVID.
Sure.
I remember I went to one of our employees' mother had passed, and it was early April. So all the restrictions were still going, early April of 2020. And 10 people, you know, you're waiting outside to try to get into the lake and you can't touch each other. And the reason I bring that up is when you mentioned the after effects, the grief that has taken place due to the loss. I feel like I don't hear that talked about enough. There are people who never got to mourn their loved ones the way you normally would have gotten to honor that loved one's life. And so what does that look like now as the world opens back up? And now you start to feel that grief a little bit more. And so we've talked in our behavioral health department, how do we do outreach in a different way, you know, to make sure that we're catching people who may have never talk to a counselor, but probably need to.
That's right. Or they may not even know that they need to.
They're like, oh yeah, I'm just irritable. Or
That's right. Or I'm just gonna I'm just gonna pull myself up by my bootstraps.
So,
well, that's another key piece that many community health centers also have integrated care.
Absolutely.
Integrated care, one-stop shop.
It's huge, and you know, so you can show up for a primary care issue, but there are counselors on site who can be integrated into your visit and just help you talk through something really, you know, brief interventions all the way to one-on-one counseling.
And sometimes, it's your primary care doc that first recognizes that what's going on with you, your stomach is always hurting, not because you have a stomach problem, but because you're depressed.
Exactly. And that kind of holistic view of people definitely played into our pandemic response. So while we were treating people, we also partnered with Gleaners and did, food, shelf-stable food boxes, like 300 a month we would distribute to our patients so they could come up and get it. So, we were treating both health and social determinants of health, and it was just a time unlike anything that we've ever experienced.
Touching lives in real ways. Well, Joslyn, we're not going to be able to have this conversation and not talk about COVID vaccine.
Right.
We are going to look folks straight in the eye.
Yes.
So turn straight to that camera.
Straight to the camera.
And make a passionate plea. Let's just do that straight together.
Yes.
Folks who are listening to us, watching us, hearing us, we really want you to know that the safe and effective COVID vaccine is readily available, and that almost 100% of those who are experiencing severe COVID disease and dying are the unvaccinated. Isn't that correct, Joslyn?
Correct.
And that we really need you to survive. We need you to survive. And in order to do that, we want you to consider talking to a trusted friend, relative, medical provider who has been vaccinated themselves. They can tell you their experience, they can walk you through it, they can hold your hand, and we really want you to consider getting vaccinated today, soon. Immediately. Joslyn, what's your thoughts on the safe and effective COVID vaccine?
First of all, the COVID vaccine is the strongest weapon we have against this pandemic. We have been vaccinating people since January. So we were community health centers were really on the front lines of that. We were one of the first non-hospital partners to get vaccines. And one thing I've said to people, it's your right to make your decision. I acknowledge that.
That's right.
But make it a well-informed one. And when I say well-informed, by reputable resources. So don't tell me, I don't want the vaccine because of some myth you heard.
That's right.
Some social media posting. It's
right.
too serious to not at least make a well-informed decision, because I believe when people actually look at the facts, they'll go get vaccinated.
Absolutely.
And so, we've done a lot of work in making the facts of, cutting through the myths of everything from microchips to, to whatever. Go on the CDC website, really look through and make a well-informed decision about getting the vaccine, but you need to get it. I know how much better I felt. I got vaccinated in January.
Yes, so did I.
Yeah, and just being able to know, I was in clinics through this whole pandemic, and so I felt safer around my parents, knowing I was vaccinated. Then when they were able to get vaccinated, it felt wonderful. When my son is able to get vaccinated, he's 10, I will be getting my son vaccinated. So, it's not just about you, it's about, your loved ones, the people that are around you.
That's
but
right.
This pandemic is not over.
It's not over.
And the safest way for you to protect yourself is to get vaccinated.
Absolutely. And Joslyn, you said a key word. You said get educated.
Yes.
I grew up hearing this, and I know this will resonate with you. My mother always told us, she quoted it, the people perish from lack of knowledge. Yes. So get educated, and we need you to survive.
Yes, we do.
So Joslyn, this is a homecoming from you.
This
Authority Health is a homecoming from you. We are proud to own you and say you got your start here.
Absolutely.
You started off first as an administrative fellow, and then you were our director of primary care initiatives, and now you're a CEO of a major community health center. So just share your thoughts about how your roots here and your start here at Authority Health helped you and prepared you for the role that you have now.
My time at Authority Health played a huge part in where I am in my career now. One thing I've told people is starting here let me see the whole spectrum of healthcare, because when I was here, we were in more of the convening role.
Okay.
And so I got to see health systems, health plans, FQH, community health centers, obviously. Sometimes we call them federally qualified health centers. work it and make sure it's community health center. But community health centers, I got to see private practitioners, community-based organizations, free clinics. I mean, the whole spectrum of healthcare passed through those doors. And so I really got to see who did what, and okay, where might I be interested? But it was just a great foundation for my career, was to start here.
Absolutely. Well, wonderful. And we get to have bragging rights.
You do get to have bragging
All
rights,
right.
absolutely.
Well, Joslyn, I want to thank you for joining me in this conversation today.
Not a
We are
problem.
certainly celebrating National Community Health Center Week, which is August 8th through the 14th. If you need information about a community health center near you, you can contact us at Authority Health 313-871-3752 and ask for Cheryl Porter Hawkins, and she will guide you to Joslyn's Community Health Center or one of the other community health centers near you. Joslyn, any final words you want to say before we sign off?
Just thank you for having me. Thank you all for the incredible work you do. I mean, you guys are a teaching health center, so I would say we're cousins.
Yes, we are. Yes.
But thank you so much. It's been an honor.
It's been a pleasure. All right. Be safe, everyone. Get vaccinated.
Yes.
See you soon.